Hey everyone! So this is a little offshoot of a video from my normal updates that I wanted to make for um, everyone who has more specific questions about the pre-op and the post-op diet. So I learned a ton of information during this last week of doctor visits and seeing my surgeon for the first time and all of that jazz. So I wanted to go into more detail about what the diet looks like. So a little background, my name's Kristen. I'm documenting my journey through weight loss surgery. I'll be getting the vertical sleeve gastrectomy, and I want to also begin this entire video by saying everyone's surgeon is different, everyone's hospital, insurance, regular doctor is all different. Everyone's body and health needs are completely different. So this is just sort of an overview of what I personally have to go through. And after all my research that I've done and all the videos I've watched, the one thing I've learned is that this is not a cookie cutter procedure in terms of what everybody goes through. It's not the same. The surgery itself might be the same, but what's required of you beforehand and what your recovery looks like is totally different. So again, this is just an example of what I'm going through. And in my other video, I did show this nice big binder that I got from the surgery center that has tons of information in it. And so I wanted to share what food looks like. So everyone who has weight loss surgery, the one constant is that everyone has to go on some sort of pre-operative diet. I've seen it as extreme as 6 months of a liver shrinking diet. Liver shrinking is the name of it. I've seen some people go 2 weeks before surgery and they go on this diet for only 2 weeks. So it really depends. Some people call it a pre-op diet, some people call it liver shrinking. Essentially, all it is to shrink the liver that lays on your stomach. So your liver lays over your stomach like a big blanket. And while they're doing the surgery, they need to move your liver out of the way to operate on your stomach. And most people who have a poor diet have a big, heavy, fatty liver. And they want your liver to be as lean and mean and light and fat-free as possible so that it doesn't cause complications. And my surgeon actually said worst case scenario is they will have to cut you open and do the surgery if they can't move your liver out of the way enough. And normally most weight loss surgery is done laparoscopically, so your recovery time is much faster. They're not having to cut you open with a big scar and go, cut through your muscle tissue. So that's usually the idea behind a pre-op diet. It also helps show that you can follow instructions, you can follow a diet, you can follow the rules, because after the surgery, you don't have a choice. You either follow the rules or you get sick, you hurt yourself, you hurt the stomach and the incisions, the area that's being healed, or you compromise the nutrition that you're getting. So just want to start that off, start the video off with all of that stuff. So my liver shrinking diet, my doctor wants me to go on for a few months. I have about 3 months that I need to wait before I get the surgery, 2 to 3 months. And the diet that they gave me is actually 2 options, so I get to choose what's best for me. The first option is I can either do 2 protein shakes a day and then a meal that consists of low carb or no carbs, lean protein, and lots of vegetables. And I just don't think that'll work for me because the protein shake thing is a little intense. I think I need to eat an actual meal. So luckily I get a second option, which is 3 meals a day with 3 ounces of lean protein, lots of vegetables, and if I need to, I can have a snack twice a day of fruit. So essentially this diet, your preoperative diet, is super healthy, no carbs, no processed foods, just cutting out all the crap. And like I said, some people go on a 2-week pre-op liquid diet right before their surgery. And again, that's up to your surgeon. So that was the biggest thing that I learned last week. And so the next part that we covered was your recovery diet and what your diet will look like post-op. And before I start any of that, the 3 things that are most important that they made sure you understand, that for your recovery and pretty much after the surgery for the rest of your life, your 3 most important areas to focus on are always staying hydrated, getting all your fluids, your water, all of that. The second is getting enough protein, between 80 and 110, up to 110 grams. And that's dependent on height and male, female, I think, as well. But your doctor will tell you that. So staying hydrated, getting your protein and your supplements. And it feels like for the first probably 2 months after your surgery, that's all you're focusing on, is making sure you're getting all your water in, all your protein in. It's hard enough to get 3 of these in a day, which is supposed to be my daily requirement. And imagine trying to do this when your stomach is the size of a shot glass, maybe 2 shot glasses, if you're lucky, right after surgery. So it really feels like the point that they drove home was that you were going to be sipping water constantly, and you were going to be sipping protein drinks constantly. So those are the 3 major things to take away from post-op diet. So another point is your recovery diet happens in 4 stages. So you go from a clear liquid, which is the first 2 days that you're in the hospital. And then you go into a full liquid, which is for 2 weeks. Then you see your doctor for a consultation, make sure that everything's good, like follow-up, not consultation. So you follow up with your surgeon. They tell you, okay, everything's looking great. Now you can move on to the 3rd stage, which is soft foods and pureed foods. And you're on that for another 2 weeks. I think it's actually soft food is 2 weeks. So that's a month. And then for the next month, for 4 weeks, you're on a pureed food diet. So clear liquids in the hospital, full liquids for 2 weeks. Another 2 weeks is soft foods. And then a month are pureed, soft kind of foods. And I'll explain all of those in great detail. So the first, again, everyone's hospital stay is different. So some people were only given water and ice during their hospital stay. I've heard that before. My hospital is going to give me water, ice, fat-free chicken broth or vegetable broth. It says here I could even have vitamin water if I wanted. You could have sugar-free gelatin. So after the surgery, I think 12 hours or maybe 24 hours after the surgery, whatever, I think the next morning, I take a swallow test, and as long as my stomach isn't leaking and everything looks good, I get started on this liquid diet. So I'm in the hospital for 2 days. When I get home, I can go on to what they call a full liquid diet, which are things like I can start to drink milk, which I don't usually drink, but I drink almond milk. So I can drink almond milk, I can have yogurt, I can have more chicken broth or broth of any kind. I can eat creamed soups as long as there's no chunks in it. It has to be strained. and any sugar-free popsicles or sugar-free drinks, and of course my protein shakes or protein drinks or putting protein powder in different things, because again, you're trying to get all of your protein in. Most people can't get a lot of their protein in. I think maybe like they can get up to 70, I've heard, or maybe some people can't, I don't know, but it seemed to be a struggle for a lot of people that I know. I can also start taking my supplements, which are mostly chewables and liquids, stuff like that. So I'm on that for 2 weeks. Then I see my doctor. She tells me, I follow up with her. If she tells me everything's okay and I can move forward, then I start a pureed diet for 2 weeks. And that's exactly what it sounds like. It's kind of soft foods a little bit. I can eat scrambled eggs, soft boiled eggs. I can have more broth. I can have, let's see what else. Oh, canned tuna or chicken. I can eat cottage cheese or soft cheeses. I can start to have like bananas or tofu. And then of course more pureed soups or anything that I've had in the last, like for my previous diets. So that lasts 2 weeks. So that's a month after surgery. I believe, I don't know if I see my surgeon. I don't remember if I see my surgeon at the 1 month mark. I don't know. I don't remember. But after 4 weeks of surgery, you start a soft food diet. And that is things, all the stuff you've been eating. Plus you can start to incorporate things like lunch meat, finely ground chicken or turkey. You can start to eat baked or grilled fish. Well-cooked vegetables like carrots, squash. You can also start to do like mushrooms, tomatoes, anything like that. And so that lasts for 2 weeks. Or I'm sorry, I take that back. That diet lasts for a month. 4 weeks is when you're on that. So 2 months after surgery is when you start to eat normal foods. You start to reintroduce normal things that you would eat. Of course, they want to keep no carbs, so breads, pastas, noodles. They don't want you to go back to that, or they don't want you to go back to junk food and sodas. And you're really slowly reintroducing stuff to see how you tolerate them. So a couple of examples that they use. You can do cooked vegetables. You can start to do soft fruits. You can eat nuts again. And really just introduce all the stuff that you would normally eat on a healthy diet and see how you tolerate it. So that is an overview of what a pre-operative and post-operative diet look like. So you have your liver shrinking, and then you have your 4 stages of recovery. Your liquid diet, your pureed diet, your soft foods diet, and then your regular diet. So I'll keep you guys updated on where I am with the liver shrinking diet and how hard it is, or how easy it is, hopefully. Think positively, and feel free to leave any questions, comments, suggestions, or tips, and I'll talk to you guys soon.